Good morning, everyone. So we will start the briefing session shortly. So today we have a briefing on SOP for Aimst Frontliners. So we are with Associate Professor Dr. Saraswati Beena Rai. She has a vast experience in community medicine, and she has an MBBS from University of Mysore and public health from University of Malaya, and her field is epidemiology. Macam all the disease outbreak investigation, pakka, she's a pakka in the whole country, and she will be sharing with us the SOP of how to manage and how to prevent COVID-19 dalam campus Aimst University.
Shall I take over?
Yeah, please take over, Dr. Beena.
Okay, let me share screen first.
Yeah, is it allowing? Yeah.
No.
Done. You can allow it.
Okay.
You can give a short briefing and then share, madam.
Okay, Ken. Right.
Okay, you are on the screen.
All right. Okay. Good morning. Selamat pagi. Salam sejahtera, everybody. So today, what I'm going to do is to give a very short briefing on COVID-19 SOP for frontliners in Aimst. So yang ini saya akan cuba untuk menyampaikan dalam masa yang singkat sekali, so that you can always ask questions after that. So first of all, thank you, Prof. Ravi, for organizing this, and thank you for giving me the opportunity to speak to everybody. Okay. So basically, quickly, this is what I'm going to go through. Okay. So before we start, kami kena bagi tahu what Malaysia is doing kan. We have to say something. So very quickly, what the country is doing is they are doing surveillance. So ini bermaksud mereka sedang membuat pemantauan di seluruh negara ke atas rakyat supaya sesiapa yang ada simptom ILI. ILI is influenza-like illness. Bermaksud if you have even slight cough and cold or ada penyakit yang lebih serious lagi like SARI. So there is a surveillance, and sesiapa yang dianggap sebagai a contact, they go find all the contacts, they will take them, we will isolate them, and then the reason why we want to do it is to break the chain of transmission. So one way of doing it is tightening state and district borders, because you are unable to travel outside the state right now, and it is there throughout the whole country. Ini bermaksud kami tidak boleh keluar daripada negeri masing-masing. Okay, just secara keseluruhan, ini adalah bilangan kes yang telah dilaporkan kemarin dan jumlah keseluruhan, which means overall we have 141,533 cases. If you all remember, just a few months ago, we were less than 1/3 of this. Ini bermaksud bilangan kes telah meningkat secara mendadak through exponentially increase. And ini is our beloved Kedah, negeri Kedah, di mana we are all from Kuala Muda. Kuala Muda, specifically, we are in Semeling. If you understand, Semeling is so small. Semeling kecil saja. And you've already got 5 active cases in Semeling right now. And ramai, a lot of you all come from Sungai Petani and Merbuk, but Sungai Petani has got 141 active cases, which is actually frightening, which means that there are people out there who are slowly spreading the disease. So, which is why we are very, very careful. Kemarin sahaja di Kedah ada 62 kes yang telah dilaporkan. That is a lot, 62 cases. Okay, secara ringkas, This is what is allowed and tidak dibenarkan. These states are red already lah. This is where I am right now in Penang. Tetapi Kedah, with Pahang, Perak, Negeri Sembilan, Terengganu dan Kelantan is under apa yang kita panggil PKB bersyarat, conditional MCO. Again, sama, social activity. You cannot group together, you cannot have weddings, no conferences, no thaipusam, no meeting, no seminar, no nothing. So it is not allowed in these two states. Inter-district travel is allowed. Bermaksud you can go from Sungai Petani to Kota Star, you can drive to Alor Star and so forth. But you cannot leave the state. Tidak boleh keluar negeri. And I am stuck by 10-kilometer radius, but you are all okay. And lain semua sama macam as before. And management staff, only 30% allowed to be in office for throughout. And the support staff is to be determined by each employer. Bermaksud, Aimst University can tell you how many of you all need to work. But we all appreciate, kami berasa bangga sebab anda semua ada di sini as frontliners because we depend on you all. Okay. So the rest doesn't matter. Okay. So I have to talk a little bit about the symptoms of COVID because without telling you about the symptoms, I cannot explain about the other actions that we have to take. Those who are in the wardens, those who are working with the students, you have to watch out for these symptoms. Okay, cough, shortness of breath, bermaksud sesak nafas, okay, fever and chills, demam, muscle or body ache, dia akan rasa letih, lesu dan sebagainya. And please don't forget, vomiting and diarrhea is also a symptom of COVID. And ramai yang kata saya tak boleh hidup, saya tak boleh rasa makanan yang saya makan, which means they don't taste or smell anything. And symptoms can range from mild to illness, so severe illness. It could be sikit saja or it could be a lot. So there is a wide range of illness that you can have. And bagaimana ia merebak is very, very important. It spreads from person to person, dari seorang ke seorang. And all of you all, please note that if I don't wear my mask and I go and cough in the lift, if I go and cough and sneeze even in my room, it can be left. There could be COVID on the lift buttons. There could be COVID on my computer. There could be COVID on my handphone. Anything, even on the door handles. I put this slide so that dalam proses pembersihan untuk memberi tumpuan kepada tempat-tempat yang ini. So please pay attention to those surfaces. So siapa yang, who are those who are vulnerable? Are the healthcare workers, people over 60 years of age. There's a lot of staff who are over 60 years of age. And those of you with underlying health conditions, kalau you ada diabetes or whether you're immunocompromised and so forth. So those are the vulnerable people. So let me finish with that quickly. So what do we want the frontliners to do? You all are very important to us because we depend on you all to keep Aimst safe for us. So what do we want you to do? Number one, please yourself stay safe. So ini macam lagu yang saya selalu menyanyi. Same thing over and over again. Cover your face in public. Please wear your mask. Practice good hygiene. Monitor your health. Keep your distance. And lagi satu, stay informed. So we need to do all these things, and it's like I've been singing the same song over and over again. Good personal hygiene. Number satu, if we don't take care of ourselves, how can we take care of other people? Because you all are, if there are wardens, there are cleaners, the cleaners are going to go around. If they are not well, they are going to spread the disease as they go mop. They're going to cough somewhere and spread the disease. So good personal hygiene is very important. Wash hands, hand hygiene. So you must have this habit that kalaulah you balik ke rumah daripada keluar ke mana-mana, first step, pergi terus ke sinki dan cuci basuh tangan. You have to wash your hands, cuci tangan. You have to wash your hands. Okay, and sorry, and 1 meter, dia kata selalu social distance, social distance, social distance. So social distancing, and don't touch your eyes, nose and mouth. Okay, respiratory etiquette. Ramai yang saya nampak dia akan bersin tapi dia tak tutup mulut dan hidung. So when you cough, I don't know why it's running, sorry. So when you cough or sneeze, please cover your nose and mouth with a tissue and not into jangan. I'm sorry, I have to put on the video again. That video. Please do not sneeze inside your hands. So sneeze and throw away the tissue. If you put in here, kalau you perlu, you have to sneeze into your hands, please go straight and wash your hands. Okay, mask. You all are very important. I'm going to make this short sebab I have only about 20 to 25 minutes. Okay. Surgical ada dua jenis mask. Surgical yang biru and all the fabric mask. So you have to use it in the public places, but please, if you wear a mask, please wear it properly. Ramai yang wear the mask below the nose. It cannot be below the nose so that you can breathe. The mask must be covering your nose. Mesti lekat dengan betul. So please cover yourselves, otherwise don't bother wearing a mask. Okay, I'm going to jump this slide. So, action at the workplace. All the employees entering the workplace must have their temperature checked. Basically, they only need to check once a day is probably enough, maybe in the morning and maybe in the afternoon if you go out and come back. What are you doing? You're watching out for those yang ada suhu badan yang lebih daripada 37.5 Celsius. What else are you looking for? You're looking for those with symptoms. And then, especially visitors, if they come, they have to do hand sanitization at entrance. We don't know where they have come from. They may have gone anywhere and coming into the Aimst University, and they're going to touch a lot of things. So make them do hand sanitization. Make sure your workplace is regularly cleaned, and especially apa yang kita panggil as high touch areas. High touch areas bermaksud tempat-tempat di dalam universiti ini di mana kami sentiasa sentuh, where we are always touching. So those areas need to be focused on. That's like the lift, macam lift button, where people are always pressing on the lift button. Okay? And whatever you do, don't shake hands. Tak perlu salam already. If most you bought macam ini or give the Malaysian greeting is more than enough. Okay? So we make sure that everybody has got easy access to hand washing. If not, we give hand sanitizers. But I think Aimst tak ada masalah. There's so many toilets all over the place, every floor, and everyone has got access. So those who are in the toilet or other whose job is to maintain the toilet, please make sure in the toilet you have adequate supply of liquid soap. We don't need disposable towels because kami ada the, what do you call it? The electric blower there. So that is fine. Okay. But please make sure there is rubbish bins yang ada where they can throw the tissue papers that they use. Ini mesti ada di dalam toilets. Okay. And another thing is that, but we have this in our clinic, surgical mask for those who develop respiratory symptoms. Okay, so for the wardens and students, and for the wardens, your own safety is crucial. We already have a system in place. I think most of it is already done. Tetapi, please make sure that all students in indoor public places must wear a mask. Very often saya nampak, sering kali saya nampak students yang masuk ke dalam even the cafeteria or inside the Aimst campus building tanpa memakai mask. So you also have a right to tell them nicely, please wear a mask, and not to allow gatherings in large groups. Sometimes you think that you can get away with it, they try and group together. So for this period, do not allow anyone to gather in large groups. And please, because you are with the students all the time, watch out for students with symptoms. Sometimes mungkin they don't want to be quarantined, dia tak mau masuk ke dalam quarantine. They get worried. They may not tell anyone. But if you see someone with symptoms, please notify. And we encourage, and we encourage, where is it? And we encourage the students to ventilate their rooms. And sekali-sekala you masuk students dalam quarantine, please make sure they don't break the quarantine. And right now, jogging and exercise is allowed. Bermaksud, the students can go outside and jog and exercise. So please don't stop them, but they cannot exercise in large groups. So if they want to jog, it's okay, no problem. Even here in Penang, I can go outside and jog, no problem for me, but not more than 2 people at a time. So if you see anything that is not okay, please tell them to stop or report. So if you are disinfection, high touch surface, ini bermaksud surfaces yang sering kali kami sentuh. So first thing, if the surfaces are dirty, they should be cleaned using a detergent or soap and water before you disinfect. So kalau lah ini it's dirty, don't just straight away use a disinfection, it will not clean. You have to use soap and water. And what do you use for disinfection? Our most famous is Clorox. You can use household bleach, alcohol solutions, but alcohol must be at least 70% alcohol. And you can use Clorox, but at the back, di belakang botol ini, they tell you what is the constitution of the Clorox. So you have to calculate that. But if you're using bleach straight away, sodium hypochlorite, the concentration that is being used all the time that we have been advocating for years is 0.1% or 1,000 parts per million, which means basically if you're using, you check at the back of the chlorine. Kalau is 5% strength, then it is 1 part to 49 parts of water.
1:50.
And alcohol, sorry, 1:50, sorry.
1 liter, 49 liter air. Mix for the cleaning with Clorox.
Yes, untuk Clorox.
Okay, thank you.
So the thing we want to tell you all is, sekali-sekala you see something on the floor, you nampak satu tempat di lantai yang really dirty. But please, if you are cleaning, you must always start from the cleanest area to the most soil dirtiest area. Because bila you mop, you don't want to mop from the dirty surface and bring it to the clean surface. So start from clean and then go to dirty. And then you clean the mop. Because we have to make sure that the dirt is not spread throughout. Saya harap semua faham maksud saya. So we'll open up for questions and you can ask. Okay? Prof, how much time have I got?
You still have another 20 minutes, 18 minutes.
Okay, 18 minutes. So I'll go very fast because, okay, please take care of the lifts. And if you want to use the lifts, please give priority to the elderly. That's saja. And just make sure, pastikan siapa yang masuk ke dalam lift is wearing mask. Okay? Student dorms, already I think it's very well organized. But just try that if there's anyone under quarantine, they have the toilets which is personalized for them. Okay, so what do we want at the end? What we want is, sekiranya one person is a contact, we want to make sure that the number of people who are in contact with them is limited. We don't want to quarantine the whole campus. We want to quarantine just a small group of people. Itu saja yang we are aiming for. That's why I kata we depend on all of you all so much. So cafeteria is already done and it's very well now. It's not like this anymore. But if there are a lot of students, maybe we should consider staggered lunchtime. If there are a lot of students. If they are not, it's fine. But seating, pastikan siapa yang duduk di sini tidak melebihi the norma yang telah ditetapkan. So don't make sure, you know, especially after 5, they will start together. So make sure they don't break the norms. That is your role because you're there. And I think students and staff who are staying outside, no problem already. So during this MCPM, CMCO, EXCO, so sudah masuk dalam, all the movement has been curtailed. So you don't have a problem with that. Prof, the gym is closed, right?
Yeah, gym
Or
and
open?
all are closed now. We have a SOP for that.
Okay. I think in CMCO areas, it's all closed, so no problem. So the only thing that you need to check on is that please don't stop people from jogging and exercising. So just make sure they don't jog in groups. Lagi satu, we already have this, so tak ada masalah. Kami have got the My Sejahtera. And what we want, even all of you all, please log into it every day. Bermaksud pakailah My Sejahtera setiap hari ya. Okay. I don't know if you all know this. I checked this out this morning. My functions of My Sejahtera, I can see whether there is a case 1 kilometer around me. So I was told around di sekeliling 1 kilometer dari tempat yang saya duduk sekarang, tak ada kes. Dan di sekeliling Aimst University 1 kilometer tidak ada kes. But don't be so happy because 1 kilometer out of Aimst, there's nothing there. By the time you reach the university, what do you call it? Taman University is more than 1 kilometer already. So basically inside Aimst tak ada case. That's what it means. Okay. So summer. So staff, if you're ill, please don't come to work. Okay. I tak mau talk on that. So sekiranya any one of you all come out with symptoms, please just stop working. Make sure you have a mask. Pastikan ada mask selalu. Isolate in a suitable room. So kalau di Aimst, cari satu tempat di mana tidak ada sesiapa dekat, okay? And notify your superior. Because we also are worried. You are our frontliners. We need you. And we cannot afford to have any of you all sick. Okay? So if you are sick, please tell the supervisor. So what do we want in Aimst is, kami memastikan tidak ada kes di dalam universiti ini. Dan sekira ada satu kes, kami memastikan bahawa kes itu tidak merebak dan tidak merebak, tidak menjadi satu kluster. So you as frontliners have to identify, you have to detect, you have to notify us, you have to watch out, and you have a role to play. Actually, the frontliners, all of you all are so important to us. Okay, please keep all the emergency contact numbers, and please don't break any of the rules. We don't want to hear that any of you all got compounded or whatever. Compound is RM1,000. We don't want to hear about that. Okay, so number satu, please know that in reality, this is akan teruskan untuk, saya pun tak boleh pasti for how many months. It is going to go on until a herd immunity is developed. If the vaccine comes, we will all try and get the vaccines. Hopefully we'll all try. But right now, there's nothing we can do. Social distancing, physical distancing, personal hygiene, cough etiquette, and we depend on you all for the job that is given to you all, and you help in a way to keep us safe. Because we are staff. I'm staff. I just go teach and then I go back home. But you all are there in the inside Aimst, seeing everybody. You are the ones who are with keeping an eye on the students, keeping an eye in the building. So we really depend on you all so much. Okay? And we also in the process have to be responsible for our own health. Jaga diri sendiri. And also, please note, any one of you all, kalau rasa that you get anxiety or depression or whatever you feel, please know that there is a mental health, Miss Lakshmi and a team are there. They will help you anytime you need help. So you're not alone. We are all in this together. Kami. So macam saya katakan, lagu yang sama selalu. Social distancing, pakai mask, kebersihan diri, hand hygiene, avoid crowded place, stay at home if you can. But dia katakan, the frontliners are the ones who are working. So you all are the frontliners and we depend on you all so much. So in summary, employer's responsibility is number one, conduct body checks, temperature and symptom check before the employees enter the premise. Provide a place to wash hands and use hand sanitizer. Sudah dibuat di seluruh universiti ini. Regular carry out cleansing and disinfection, especially shared spaces, which is what we depend on the cleaners and those who are doing it to do. And throughout, you maintain your social distancing. And please note, I have to end with this slide. We are all outside our comfort zone. Ada ramai yang tak ada kerja, ada ramai yang duduk di rumah. So we are happy we are here. So let us make sure that we do what we have to do to keep Aimst safe. Okay, so you can upload the My Sejahtera, but in the same time, please be responsible for your own health as well. And we have a life to lead. So whatever you do, stay safe. Please know this will end. Bila dia akan berakhir, I cannot answer you, but it will end sometime. So in the meantime, we are standing together. We are one. And we are with you. Prof. Ravi is with you. He will make sure you're all taken care of as well. So please note we are one. Okay? I will end there and take questions, which I think is more important, Prof.
Okay. Thank you very much, Dr. Bina Rai. It's wonderful to have you here. It's a rare opportunity. Exactly, we have around 9 minutes to have a Q&A. And I just want to ask you, first question is, if anybody with more than 37.5 degree centigrade, what the security and warden should do?
I think the temperatures, the thermometer is going to beep as well. So the moment you hear that beep or it turns, gives a signal, please make sure that that person is taken away and call the clinic, send the patient to the clinic. Isolate, make sure he's wearing, they all should be wearing a mask anyway.
In the case of when they see people with a higher temperature, can they send them back or they?
Yes, for security, very easy, send them back. They cannot enter the campus.
Okay.
Unless it's a staff living in campus, then there's nothing you can do. You have to allow the staff to go in.
Okay.
But if it's a vendor, it's somebody else coming in, they can go. But again, Prof, on a case-to-case basis, if the student has traveled all the way from KL for some reason and come here, he can't go back.
Okay.
They just have to call the clinic to handle it.
Okay. And so the gym and the sports facilities, are we allowed to operate with the social distancing or should we close down?
Okay. According to the norms, you can have the gym because in CMCO, the gym was open.
Okay. Okay.
But if you do, I've been going to the gym before the MCO, but they're very careful. Only limited number of people can go in. So probably our gym is small, only 4 or 5 maybe, but somebody has to monitor that. And again, if they're using the gym, they have to, the spray is there.
Okay.
For us, we spray before you use, we spray after we use. We clean before, we clean after.
Okay. Okay, we noted. One question is about, let's say somebody falls sick, have fever, what they should do, what they should do.
I would say call the clinic straight away, but call the clinic before going to the clinic. Don't just go and stand in front of the clinic, because in the process you're going to go through a lot of things.
Okay.
You're going to be exposed and exposing a lot. Just call the clinic.
Okay. And there's a lot of question about vaccine. Is it safe to, let's say if it is implemented, is it safe to take or you should not take? What is your recommendation?
I will take.
Okay. Honestly, all the vaccines been already extensively tested. Don't believe in all the social media things, and all the vaccines are safe. Better than getting COVID than taking a vaccine.
Yes. If you balance between the two, vaccines and getting COVID, I wouldn't even think saya akan ambil vaccine.
Okay. And there are some vaccine trials they are mooting up, and they are coming up. What your advice on joining a vaccine trial?
They will explain to you everything about the vaccines before you join the trial. And dalam vaccine trial itu bukan semua yang akan mendapat vaksin. Some of you are going to get a placebo. So it is a trial, and it is being done di 9 buah hospital di negara ini.
Okay.
So they will approach you, but they are very careful about the age group. So I can't go and take part in the trial. It has to be somebody under 55 years old.
Okay.
There is an age limit.
Yeah, one question, common question. Kalau ada, now the COVID is in the community, and if kalau satu orang the close contact with the COVID case, what they should do?
Okay, if there's a positive case and you are a close contact, you're automatically going to be quarantined right now. Okay, so quarantine, it depends on the location. If I'm living in Penang, they got no more place for quarantine. I'm going to sit probably in Pisa or somewhere. But here, it is as determined by the state health department. They will decide where you're going to be quarantined. The people that we are self-isolating here are not those identified by the state or by the district health office. So they are under basically self-isolation, which is different from official quarantine. Official quarantine, you akan dapat the pink tag, the bracelet.
Okay.
So the rest of us are self-isolation.
Yeah, that's a common question. Actually, the last question I wanted to ask you was, what is self-isolation and quarantine? I think you cleared it very well. Yeah.
So Aimst, we are playing it safe because we cannot afford to have anything go wrong in here. So that's why we are doing this. And we will continue.
Okay, one question from a warden here. Our female warden, Miss Lalita, she says, if a student kalau ada flu or a fever, and can they take them to a nearby clinic?
Now with flu and fever, there's always the go through our clinic first.
Okay.
Let them do a case definition before they go anywhere else.
Okay. Better to be screened by the clinic first. Okay. And one question about the student clothes. Let's say the students, we have self-isolated students. Sometimes they come from a hospital, COVID, they are there. The clothes should be sent to the laundry separately. Can the clothes be mixed with the other students' clothes in the laundry?
There is always that element of doubt that it could be COVID. So if they can send to the laundry, there's no harm in that because the soap and water will destroy it. But do not mix with other students' clothes.
Okay. And I have one question from the cleaners. Let's say the student in the isolation room, can the cleaner enter the room and do the cleaning?
They can go in because there's a difference now because they are not COVID contact, really. We have isolated them. If the cleaners go in, please wear all the masking, don't touch anything that, if you are cleaning the tables, please use gloves.
Okay.
They are not, they are under self-isolation. They are not under official quarantine. If official quarantine, then it's different. You need to let them clean it themselves. It's better still, because they can do it. No, it's not like it's difficult.
Okay. Thank you very much, Dr. Beena. I think on behalf of Aimst University and all the staff members who are gathered here, we'd like to thank you very much for your kind time. And though you are there stuck in Penang, and you gave a very good, clear explanation, and also you gave a briefing in Bahasa Malaysia. I think it's very interesting, and our staff are ever committed. I have very strong confidence on my security staff and wardens and all the cleaners and all the heads who are here. I think we really sincerely appreciate, and we have around 2 minutes. It will be on. Anyone want to raise any question? And after that, it will shut down by itself.
But Prof, you have to thank all the frontliners because they are doing an excellent job. Basically, they are keeping us safe.
We really appreciate them. I think they need a standing ovation. So we really appreciate them. Actually, almost 1 year they made the campus safe. I think they really need a
very good,
very much rewarding thing, and I think we really appreciate. Let's keep it up, and we have come to the big stage, and they will support us definitely.
Yes.
Okay. Okay, madam. Thank you. Thank you very much.
Okay. Thank you, Prof.
Yes. Yeah, thank you. And we will do one more session on counseling with Miss Lakshmi. Yeah. I'll talk to her.
Yeah, that would be good. Yes.
And
thank you, Prof.
We also separated different zones. I think we need your guidance to monitor the zones. For the
yes, now I'll do the checklist now.
Okay. Thank you so much. Thank you. Thank you so much.
Bye.
Bye.